The Bogalusa heart study suggested that, children have these fatty streaks as young as age 2 that are precursors to heart disease. So we have to start as early as possible. In fact, we need to start before they're even born, don't we?
Yeah, that's right. There's some prenatal influences that actually also are transmitted genetically. So you're absolutely right. I just had the good fortune in meeting the director of the Bogalusa study, an elderly gentleman now. He started this about 60-some years ago.
Right.
And they showed that that heart disease is not something that happens when you're 7 or 8 years of age.
Right.
As you already suggested.
Yeah.
That is really a pediatric problem.
Yes.
It starts when you are under 2 years of age. You can already document. I mean, here's what they have done. They've taken mothers that were feeding their children or the unborn child. During pregnancy, they were either on a regular American diet or they were following a very, very healthy diet. And then they found that these in this case, the baby that they carried was stillborn. It didn't make it. And so when they looked at the autopsy, they could actually identify, not knowing who it was, they could identify from looking at the aorta, the large vessel in the child, in the baby that had died. They could look at that aorta and say, this baby comes from a mother that was on an American diet, and this baby came from a mother that was on a healthy diet. Imagine, these are already prenatal influences.
Yeah, that's right.
And so health begins in utero.
Yes.
And that's why it's so important to help mothers to begin to move towards a more sensible diet that come to us from the medical profession, unfortunately. Really.
Right.
You are a glorious exception there. but the culture is driving these habits and the dietary patterns, and we need to begin a child health in utero.